Hi, I'm Gene Bergman. I'm a Ward 2 City Councilor in Burlington, and I want to welcome you to this month's edition of Burlington Progressives TV. This is a monthly show that we've got, and what we try to do is explore community issues, the issues that are facing the city, our people, our environment, and really sort of get a chance to talk about things that are not part of the political conversation. We've had community members talk about police oversight and also state issues like the tax fairness that we've got in the state or the lack thereof. We've had politicians talk about the housing crisis and progressive taxation. And excuse me. And this month, what we're going to talk about is justice in the workplace, and in particular, the union struggle around the UVM Medical Center's support staff. And I just want to start. Well, first of all, I want to welcome you guys. Thank you. Jacob and Lou and Heather, thank you really very much for joining me on this. I want to frame this because, you know, Burlington Progressives are part of a progressive party, and so it's a political organization. So what the heck are we doing? You know, like talking not about politics. And the reason is because our party is fundamentally concerned with economic justice and with the rights of workers. So I just want to read for the folks there, and I will read excerpts from our principles so you understand why this is important to me. And as a former union member of the GCIU, in a failed attempt to get a contract with the Burlington Free Press many decades ago, my heart is with you all. So the purpose of the Progressive Party is to promote economic, social, and environmental justice, sustainability through electoral and other democratic political activities, like this, like your union drive. Democracy requires empowering people not only in government, but also in the workplace, schools, and in the overall economy. Society's wealth should not be concentrated in the hands of a few, and a wealthy minority should not control the conditions under which we live. Here's one that I think is really pertinent. Collective organizing is essential for people of low and moderate income to attain economic justice. Everyone is entitled to decent work at a living wage in a safe working environment. I'm going to stop there because this has gone on long enough. We've got a few more there. But all of these, to my understanding, are things that you guys are working on every single day in your work lives, and because it never spills, it doesn't stop in your home, with your families, with your extended families. And so, again, I want to thank you so much. And I'm about done with my yapping, but I'd love for you guys to tell us who you are and what your job titles are, but also what you do, right? Because people need to know what you do and understand that. So I don't really care who starts.
So my name is Jacob Berkowitz. I'm a staffing office specialist at UVMMC. Basically, my job is to staff the hospital, which can be a challenge. I work with 15 plus inpatient nursing units, and I've been doing the job for almost 3 years.
15, that's
Yes.
a lot.
Yep, and I'm in charge of all the nurses that work with those units, essentially. All the LNAs, licensed nursing assistants, and the clinical patient safety attendants. So there's a resource pool that I'm in charge of to try and fill the plethora of gaps.
Wow. We'll go into the challenges. I believe you'll tell me about the number of calls that you all make, for example. I think it's pretty amazing.
Absolutely.
But thanks, Jacob. Sure, Lou, you're next down the line. Hi.
Hi, I'm an operational support.
So,
Sorry.
and your last name, Lou, is Lou Levesque.
That's correct, Lou Levesque. Yes.
There we have it.
Yes. I'm an operational support specialist. So I work on the outpatient side. So that means that I am the main trainer of a doctor's office. So in a doctor's office, you might have a scheduler and a medical assistant, and then you'll have a supervisor. And so I'm sort of middle management between the two. But I'm in a unique position in the sense that I'm boots on the ground, and also having a hand in helping the next group of workers come in. My day looks like taking the referrals that your providers send to us and helping get them to the right scheduler so that you can have your, I work in neurology, so a subspecialty appointment, something like that.
Well, that's seriously important, having been referred to a variety of different UVMMC facilities. If that referral doesn't make it there,
That's right.
It's not really a good thing.
Yeah, and support staffing is really integral to getting those steps through the process.
You mean they just doesn't happen automatically, magically?
We'd love it to be that way.
No, we wouldn't. The AI is a whole nother show that we'll have, but human beings are essential, unless they're gonna, no, we won't go there. Great. Heather, hi.
Hi, my name is Heather Bauman, and I am a direct care provider as a phlebotomist. And so
What is a phlebotomist?
that I'm the person who tries to make one of the worst experiences or most fearful experiences at the hospital pleasant for people. I draw blood.
You draw blood.
And that means we work in one of the 3 outpatient clinics at the Fanny Allen at 1 South Prospect, or at the clinic within the hospital, or else sometimes I work inpatient like I did this morning. Working at the clinic sites means, greeting the patients who show up.
Like clinics where?
So there's one just across the street from the main hospital. There's one in the hospital, and then there's one over in the medical office building next to Fanny Allen.
Okay.
Yeah, and we see hundreds of patients a day, many of whom first thing in the morning have been fasting.
Yep.
And are not excited, and the hangover is real. And then also in the hospital, we usually have about 200 draws spread out over the 5 buildings of the inpatient structure that we're supposed to get 6 of us usually within an hour.
Well, I have to say, and medical privacy is personal, so I am able to say myself that the last time I got blood drawn at the Gosburian unit was an amazing experience. It was great. It took no time to get in and out, and it was painless. And then I got to go ski on a powder day. So it was like a beautiful, beautiful thing. So thank you. And although the Vermont Progressive is a statewide party, this is a Burlington show, and the medical center is in Burlington. And so I know, Jacob, you're a Burlington resident.
Yep,
You
sure
live where?
In the Old North End.
In the Old North End. And Lou?
I live in Colchester.
In Colchester. And Heather?
I live just south of town in Charlotte.
In Charlotte.
Yeah.
That is actually really important, right? Because this is an issue that relates to everywhere all around us. We have this, what's the I'm going to call it a euphemism, but of the hospital itself. It's like a trauma center, for
Trauma 1 Center.
Trauma 1 Center.
Yeah.
Right. I mean, this is a big deal.
Right.
And there are, and we're going to go to slides now. How many people are in your union?
I think it's over 2,300. Yeah, and the hospital is severely understaffed. So if we were fully staffed, it would be momentous, and it already is.
As somebody who was part of a bargaining unit of about 200, you're 10 times more than 10 times that amount. That is a lot. So here we are. We see your logo there. and why don't you talk to us about who you are?
Yeah, absolutely. So, like you just touched on, we're over 2,000 of UVM MC's support staff, which includes phlebotomists like Heather. We have licensed nursing assistants who I work with very closely, environmental services workers who clean and take care of the hospital. We have the chefs and over 100 other job titles whose work is the backbone of the hospital. So when you talk about how large the union is, it's not just that it's a large amount of people, it's also a very diverse amount of people from all different job descriptions.
Janitors?
Yeah.
Building maintenance folks, those folks, people who are repairing things. I mean, like, I really believe that if you don't have people who are going to clean the bathrooms, you don't have a healthy environment. So, this seemed like it's on the bottom, but it's just on one side of a spectrum to the other. So all those folks are
Nutrition
are
workers are the folks that are the plate passers. So if you're in the hospital and you want a meal or you need a specialized diet, those are the folks that bring it to you. Make sure it's hot. Make sure it tastes good.
Yep. Any other things about, maybe we can get that slide up again in case, or the other one where it said who we are? There we go. So you mentioned about the short staffing and stuff, and we'll get into that in detail some. But 2,200 workers, and you won with an 86%. How did that happen?
It was definitely a lot of work, that's for sure. Our election was in January, and we had been working for around a year before that to sort of organize, get all of our stuff together and get the word out, because people have been, upset for a long time and have been overworked and short-staffed, for longer than just the pandemic, but the pandemic certainly, exacerbated that. And so 86%, that's, especially for a support staff union, which are notoriously difficult to form, it's not just a landslide. It's not just a landslide. It's a mandate. We have a significant chunk of support from a lot of very tired folks. But it did take a lot of work.
Well, clearly a credit to the organizing team and the union itself, and to all the other people that supported you, because this is not, as somebody who's been through it, this is not an easy thing to do.
Totally worth it, though.
Totally worth it.
Yeah, absolutely.
Well, tell us about why it's worth it. Why it is worth it, just sort of on that really personal basis.
Well, I can say one thing about just the start of it. I actually worked at the election, and I've worked at elections for years. This was my first union election, and I have never been so nervous sitting and people are casting their ballots and getting very anxious, and the mandate from the National Labor Board not to speak to anyone and not to bring anything up, but to see middle-aged, older adults coming in, and then their children coming in right after them, to see people who needed support with the translation of their ballots. It was a really moving experience. And so the reason that it's so worth it is we've come together. We raise our heads in the hall now. There's a pretty intense caste system in the hospital, but we stand a little taller and we keep our eyes up, and if we're not being seen by others, that's okay. We see each other now.
Yeah, I was in the cafeteria. It was mac and cheese day today, and I just sort of had my head down because I was thinking about mac and cheese, and I looked up, and the line chef was also wearing one of these, and she goes, "Nice shirt," and nice shirt, and it was a good little moment.
Yeah, that's very, very, very special, and this is a big deal in the private sector for you guys to have won this. This is not something. It's a major problem in the country, and you're at the vanguard of making sure that working people have dignity and respect. So there are other slides. Let's see what the next slide that we can chat about will be. Aha. So Jacob, you talked about, and Lou, you talked about short staffing. Tell us more.
So I'm in a unique position in the staffing office where I not only get to hear the stories and of people being short-staffed, but I see the numbers and all the data that goes along with it. So I'm, like I said earlier, I'm responsible for filling all the gaps, and I have a couple of snapshots of data that I think are pretty telling as far as just like the impact of what we've been going through and how it's been getting worse over time. So I had a couple of graphs that myself and one of my staffing office colleagues put together.
So these are calls that you make?
Yes. So our
That's
office.
crazy talk.
Oh yeah. So we're talking like the amount of calls that goes out per day, per shift, is extraordinary for recruitment to fill those holes by putting out, urgent pay, trying to get people in for double pay. Otherwise, the work, whether it's nurses, LNAs, et cetera, just doesn't get done. And as you can see, outside of a 2-month blank period during our infamous infamous outage of with the cyber attack,
Right.
even through the pandemic, it's been getting steadily worse as far as the amount of calls we send out per day.
The higher the number of calls, the shorter the staffing is, the bigger the gap is. That's a reflection of that.
Yes,
Greater
absolutely.
the need.
Yeah, the greater the need.
So yeah, and a lot of those calls are to support staff, particularly LNAs who, you'll talk to any LNA that works at the hospital, they'll tell you that they get, 3, 4, 5, sometimes more calls per day, to where like their mailboxes are consistently full, just from messages from me pretty much.
Saying, we need you, can you come in? Is that, so what is the call?
Basically, we have a staffing need from this time to this time, essentially please come in for urgent pay.
Sorry, tell your little kid that mom is coming or dad has got to leave after dinner because there's this really urgent emergency that we've got to do. Give them a kiss for me.
Yeah, absolutely.
Yeah, yeah.
Well, and tell them that without the urgent pay, we can't make ends meet, right? Because it's not really about wanting, it is about wanting to help your coworkers and wanting to help the community, but it's also that our wages are so low that without these urgent pay shifts, we can't make it.
That's really fascinating. You do have a slide on that, I think, or the things with money. This is an institution which pays its upper executives a lot. That was very clear when the nurses went on strike. I actually I retired on a Friday, and on Sunday I went to a strike support meeting, a community strike support meeting, and on Monday I walked the picket line and went down because I had worked for the city for a long time, and then went back to the council, to the city council, to thank them for having appointed me for 20 years and to ask them to join me on the picket line. Mm-hmm. So that experience was, pretty strong for me. So I know that the upper management is not underpaid if you got any sense of propriety.
Yeah, if it's public information. Check out ProPublica, and the tax forms are there, and the latest tax forms are from 2021, and it is it's terrible. It's disgusting.
Yeah. So you guys are, and you live all around the county. If we can get that slide up, that. So this is the shift, and it just gives you more data comes more data on what you're facing on the floors. But if we could see a slide that relates to the cost of living. We can get back to that, but let's look, since we're talking about money right now.
Are you talking about the one that has how much each person is expected?
Let's start with
We can start with this.
Let's start with this one. This
So
is a good one.
this
Yeah,
graph
what
is
this?
essentially just an indicator that wages and inflation have been like on the rise, or rather, when adjusted for inflation, wages have been stagnant versus what the actual cost
Bottom
of goods.
line is the wages that you guys have been getting paid.
Exactly. Well, just in general, this is like the employment cost index for private industry just across the country.
So this is just working people.
Yeah.
And
This is
we
just-
know that.
Yeah.
I mean, this is a problem. It's a problem with people trying to pay their taxes in Burlington. We just had this fight on Monday, tried to lower the tax rate unsuccessfully, but so this is a problem that is across the board. So that's what that shows.
Yeah.
And yep.
I think even more pertinent is this next slide that maybe goes a little bit more in depth to like recent memory. One thing that I've consistently said to my colleagues is these are the inflation numbers of the last 23 months, or 29 months rather, where inflation has been 13%, and the wage increases for support staff have not even been close to that. In fact,
So do we have a slide that goes directly to
we have an average wage increase year over year of 3%.
3%?
Yes, which is
Which is significantly less than 13%.
exactly.
Right.
In essence, we've been taking pay cuts throughout the pandemic, and the administration would probably prefer if we continue to take pay cuts, but the sense that I'm getting from my colleagues is that we're done taking pay cuts for the hospital.
Good, good. I mean, I'm proud of what the city did in terms of our unionized workforce and making raises, and it was hard, but it was the right thing to do. And so, you just have to do that. Austerity kills, and that means paying people what they need. And so there was the next slide that was up there around, so this was a survey that you did.
Yeah, we put out a survey right after our election to sort of capture what was most important to folks, so we could focus our proposals. And down at the bottom here, it says numbers based on the 641 surveys completed after this question was added. So about halfway through the survey, we added this question of which expenses do we currently struggle to afford. And it's staggering that, the two basic things, housing and nourishment, over 50% of folks.
Yeah. 70% are having a hard time
Yeah.
paying for
Roof over their head.
the roof over their head.
Jacob presented this slide at our first in-person bargaining team meeting. It was about 60 of us, and we met over at the Fletcher Free Library, and he put the slide up, and there were audible gasps from the 60. And then someone raised their hands and said, I have a colleague who sleeps in their car. And all these hands went up to indicate that in every department we have colleagues who are housing insecure and who are, showering at work, are sleeping in unsafe places, truly upsetting. And this is, again, a private industry, but, it's supposed to be providing care to the community, and it doesn't feel like care.
And that pain is not being shared, right? I mean, the CEO got a big job, no doubt, but not sharing that pain in any stretch of the imagination, does not have to worry about paying his rent or his, and I mean, the 2,200 people, and you were talking about this in terms of the election. These are older people. These are people with families and kids. These are young folks. So there's this range, and they own homes or they rent, and
I think that, there is a certain generation that owns homes. In our generation, I mean, yeah, look at that face. Same. That like, there's no way we can, working at this largest institution, there's no way we can conceive of owning a home. So a lot of us rent. Up until recently, one of our colleagues, many of them drive an hour in outside of Chittenden County.
Yeah.
Many of them do, and the rising cost of fuel doesn't help them with their expenses.
Exactly. Yeah. And these are folks that haven't just shown up there last week. This is not the starting wage.
Right.
These are people who've been working in these jobs for a long time and have, going back to that slide with the flat line of wages.
I can't remember if there's a slide about this, but that is actually one of the problems, is there's a real wage compression. And so we have people with, someone spoke the other, at one of our bargaining sessions last week about having worked here for 36 years, and no, he's not earning a livable wage after 36 years at the hospital.
That's right.
Well, we'll go on to the next slide, but I heard a telling when I was negotiating. I heard this incredible comment. I was telling this to Jacob the other day. We were talking about us being underpaid at the Free Press, and I was a production worker, right, making $9 an hour. And at the end of the day, when we showed them the compression, so to speak, and what they were making a lot of money, and what other places were making, what other workers and other unionized places were making, they just turned to us and said, "What does what we make have to do with what we pay you? We pay you what we have to. We're not yes. This is 30 years. I still say this, and I would go home as a member of the bargaining team. I'd go home crying. I had a baby at the time. Yes, and so what gives me heart, I could not make them pay people. I mean, I could make them stop taking away benefits, which is what they were doing at the time, taking away health care stuff. But you are hopefully going to show them that, okay, we're going to make you pay what's fair. So what is this next slide is just, again, let's talk to us about this.
Yeah, so all of our financial-based proposals are based on the cost of living. And, I think a lot of people might think, particularly our friends at administration, probably would scoff at the fact that we'd be asking for, $25 an hour. But unless you're, a single person with no children, which I would probably say the majority are not, it doesn't even cover the cost of living, to be honest. It's the only reasonable thing to ask for is what covers the cost of living. Anything below that is like, what are we even doing here?
Okay. So we can get into some more of what you're asking for and stuff, and we could go through the slides. But like with the staffing shortage, are they aware? Is the administration aware of the problems? And what do they say, and what is your response to what they say?
So they're very well aware. The numbers that they see, I could tell you personally that directors of the hospital see my staffing plans personally. They see all the gaps, they see all of it, they hear the stories, they're just not prioritizing correctly.
And so they know it, and that's just not part of their priorities, and you're now raising with them the need to change their priorities.
Absolutely. And to what it looks like from a patient care perspective, and I think Heather could definitely point to this, the phlebotomists are also very understaffed.
I mean, we're currently operating with a staff of, I believe, 38 people, and optimally staffed, we should have 30 more, you know. We're understaffed when you come to one of our clinics for a blood draw and you have to wait an hour and a half in the morning, you know, to get in, and heaven help you if your orders aren't all set, if your doctor forgot to, you know, dot an I or cross a T. You'll wait another hour because we have to get through to patient support services and to the lab customer services and have them help us with the orders. I mentioned before that we often have 200 patients to be drawn at 6 a.m. with 6 phlebotomists. We're expected to do 4 draws an hour. We're pretty good at our gigs, and some of us can do 6 to 8, but there's no way we can get those draws done at 6 a.m. so that the care teams have the results in time for rounding at 7 or 8 o'clock in the morning, which is what they're hoping for. We're lucky if we get the 6 a.m. draws done by the time we have a shift change at 1:30.
Wow.
And we often don't. Today I finished the last 6 a.m. draw at 1:35. I clocked out late.
Wow. Well, I was really lucky.
I mean, you know, yeah, sometimes you get lucky.
Yeah.
But most days you suffer from lower quality care because we have the the urge to provide it, but we don't have the people to help us do it. And we've lost a lot of people who can, you know, take higher paying jobs in other places.
Right. So, what is the union proposing?
In terms of wages, I mean,
Well, and the staffing.
Yeah. In terms of staffing, we have one of the things is to make it a livable wage, and we are proposing. We, you know, kind of talked about it, and we talk about it every week. We talk about it in our meetings, and we talk about it in our bargaining sessions. And you know, you say that, you know, the progressives are a political movement, but this is a personal movement for us. It is, and it is an intersection of the personal and political, if they aren't all, and. So we're looking for ways to make this job work for people so they can stay and sustain it as a life. People are not asking to get rich, they're asking to get by, and we're looking for ways to support them in living full lives as employees of UVMMC and supporting their neighbors, you know, and taking care of their community, which is really gratifying work.
Yeah.
We're looking to, as Heather said, treat our staff like humans. One of the things we're really excited about is, so we have a colleague named Hari, and he shared with us stories of his cultural holidays. And right now, regardless of your culture or your religious affiliation, you sort of go by the, you know, Judeo-Christian holidays that are established. So one of the proposals we're bringing forward is that employees can designate 3 days that can be their own, that are their own holidays. Hadi was talking about where he goes with his family to the elders who bless them and, you know, wishes for their, you know, good fortune in the year coming. And why are we, you know, forcing folks to not work on a day they're indifferent about, and instead just sort of scheduling them on a day they really need to, you know, seep into their lives. So we're really excited about that one. And you know, some of the things that we're doing as well is knowing how powerful we are as a group. Even though we're just in bargaining and in the beginning of bargaining, 600 of our folks are showing up to these meetings, and you know, we talked about the basic needs that we're being shorted, and so there's childcare and food at every bargaining session. What can we do to provide for each other? People are telling us we're not afraid anymore. We're not afraid to lift up our heads and, you know, speak to management. It went from whispered conversations over months of preparation to speaking out loud and normalizing our struggles to each other.
Yeah, it reminds me of what the Memphis sanitation workers. Yeah. Anything to add on what you're looking what you're looking for, how things are progressing?
I think things are going, you know, extremely well as far as the momentum that we have, the excitement in the room. I think a lot of the most recent proposals that we've made are definitely exciting for folks. It's not just about, the financials, though it, ensuring that we can, the people taking care of you can take care of themselves is of paramount importance. I'd actually just like to quickly share a story about one of my colleagues that I've been working with for some time. His name is Alexis Mbenge, and he is an LNA, one of the resource LNAs. I call him one of the hardest working people on the face of the planet. He constantly has to pick up urgent shifts in order to make ends meet working, I've seen weeks where he's working almost every single night during a particular week. And I think what my numbers showed earlier is there's often times where LNAs like Alexis are working on their own on a floor, meaning that he's responsible for taking care of 30 plus patients. Whereas nurses have, because of their union contract, have very set in stone staffing grids that need to be respected, so that they can take care of their patients appropriately. But LNAs and many other job positions that do take care of patients, their staffing grids, if they have them, are thrown out the window. There's no seriousness with those grids. And I think Alexis shared many stories a few weeks ago, saying basically that if he's unable to, when he's on his own and he's unable to get to a patient who needs to walk to the bathroom or something along those lines, they might wet themselves because he can't get there in time. Or he even told us one story that was very scary, where it was a night where he was alone on the floor, and he told the patient to please wait because he has to do all these other things. And he couldn't get there in time to bring the patient to the bathroom, and they ended up, cracking their head open and needed to go to the ICU. And that's something that if we had safe staffing with support staff, that would be extremely avoidable. But these are common occurrences, and I think when we say, when the hospital tries to plead poverty, it's like, well, we can afford it, and if anything, we can't afford not to stabilize support staffing levels when you think about all the effects that short staffing has over the long term.
So your proposals are to have those grids and them be enforceable?
Yes.
And also to have the support staff be a part of the conversation. That we've made proposals that there be committees composed of members of the support staff, because we're there doing the work. We know what it needs to be.
Yeah.
We're not kidding around. We're not looking, again, to get rich. We're just looking to get by, and we need some more people doing this job for us to do it well.
And their response to date?
So they haven't responded to that one yet. We did put a proposal forward about the referring to the health and safety of our colleagues in terms of violence that is inflicted upon us by patients. And the emergency department is understandably a pretty dangerous place to work. We had a colleague, Shannon, share with us a story of how she, the violence that has been inflicted against her and her husband also works there, black eyes, punched. Yeah. And they asked, please, that the hospital invest in slash-resistant gear for everyone in their department. They're very sweet and very precise, saying there's nothing slash-proof, but could we please have slash-resistant gloves and vests? And the hospital came back. The hospital is represented by one of your colleagues on the council, and councilperson Ben told us that wasn't, they really couldn't see fit for doing that. It's just too expensive, and they weren't sure it could work. And a friend from the ED stood up and pointed out that they had been stabbed that very week, while management was deciding that it wasn't worth it to invest in slash-resistant gear. Our colleagues are getting slashed. We're asking for things like a couple of days off after an incident of violence, in a room with a patient. Yeah. If you need a moment to recover from that, it shouldn't be coming out of your vacation time. It shouldn't be coming out of your sick time. the institution should care enough to give you a moment to recover from that.
Yeah.
They told us that we had misplaced it in our proposal, and that they would consider it if it were a part of a different proposal, but I'm not sure they mean that. They came, before we gave our wage proposal, they gave a wage proposal, and it was insulting and infuriating. It was extremely low, and we did get very upset, and they didn't like it that there were 600 of us in the room who were upset by their proposal, and they said that they felt, menaced or threatened or something like that. But we feel pretty under threat ourselves. But they did. That was also in that moment when their attorney, Councilman Ben, told us that he would be rejecting our wage proposal out of hand. So they are actually sitting with that, and we expect on July 12th to hear from them what they think about our proposal, which does have some differentials in it and does have, some urgent pay. But really what it does is it is a rising tide, and it raises all the boats.
Yeah.
We want all of our colleagues to be making a living wage, and we're not quite there, but we're starting everyone at $25 an hour.
Yeah, yep. Like I said, those at the top are not having to worry about paying their rent. They're not having to worry about paying childcare or paying for their food or any of the other things that are on there.
We're the ones that are right there with
Yep.
everyone has a story
Yep.
of being inpatient in the hospital, of needing care, and that one receptionist who was so sweet and made sure their insurance was right. That's us.
Yeah. At the end of the day, and we're almost going to close here and ask for some final things on you. But one of our principles is that human labor is the key to the creation of wealth. And so we challenge the assumed right to derive vast wealth from ownership or position. And that means that when you're in those bodies, that you look like you're taking care of your whole family, right? And make sure that the littlest and the most vulnerable are taken care of, that they're saved first, right? So we're almost at the end. How can people, the community, people of goodwill, regardless of political orientation, here I'm trying to reach out over the aisle, how can they partner with you? How can we support you?
That's a fantastic question. So appreciative. On the screen there, follow us on social media. It'll link you to our website. There's a petition there that you can sign, essentially saying, we support you in solidarity. And it is these collective voices from inside the hospital, from our community, that's really going to make these differences. We've seen that it works, the strength in numbers. We're here today, and we plan to keep being visible in the community. Drive by our honk and wave, honk at us, write letters to the city council, but show up for us the way we show up for you, the way we draw your blood and make sure that there are people on your floor. That's what we're asking for.
Okay.
Yeah.
Okay. Well, every way that I and my comrades on the council and in the Vermont Burlington Progressive Party can help, I know we want to do, and I do too. So I just want to thank you for taking the time. And you got any last word? Any further last words than that? If not, then
Any buttons, guys?
Thank you for having us, and thank you for providing this opportunity for us to share our cause, because it is a community cause.
Yeah.
well, this is a monthly show, and I generally wait to book people depending on these things, and so perhaps in July or in August there'll be an issue that that you'll want to have out there, and like I said, everything that we can do to support you. We're all a big family here, and solidarity is at the heart of building a decent society. And so thank
Right
you.
on.
Thank you for standing up, not just for yourselves and each other, but for all of us. Thanks.
Yeah, thank you, Gene.
Good night.